Good evening, everyone. Thank you for being here tonight. Whether you've joined us in person or are tuning in from home, I want you to know that this conversation we're about to have could genuinely change the course of your life, and specifically the life of your heart. I've been practicing cardiology for nearly 20 years. I've stood in operating rooms during bypass surgeries. I've delivered the news that someone's heart attack has left permanent damage. I've sat with families in waiting rooms and watched the weight of uncertainty settle over them like a fog. And in all of that time, the single most powerful lesson I've learned isn't a surgical technique or a pharmacological advance. It's this: the food we eat is the most potent medicine our hearts will ever encounter. Tonight, I want to take you on a deep, honest, and practical journey through the relationship between food and heart health. We'll look at the science, the real, evidence-based science, and we'll translate it into something you can carry with you into your kitchen. No gimmicks, no fad diets, just truth, delivered with the respect you deserve as someone who cares about your own health. So let's begin. Let's talk about your heart. Part 1. Understanding the heart as a living organ. Dr. Rose. Before we talk about food, I want to make sure we're all on the same page about what the heart actually is and what it does, because I find that when people understand the mechanics, they start to care differently about what they're putting into their bodies. Your heart is a fist-sized muscle sitting just left of center in your chest. It beats approximately 100,000 times per day. Over the course of an average lifetime, that's more than 2.5 billion beats. It pumps roughly 5 liters of blood per minute, about the entire volume of blood in your body, every 60 seconds. It never rests. It doesn't get a coffee break. It just works, continuously, from before you're born until the moment you die. Now, here's what I want you to think about. That muscle is fed by its own dedicated blood supply, the coronary arteries, and those arteries are profoundly sensitive to what circulates through them. Every meal you eat enters your bloodstream within hours. The fats, the sugars, the proteins, the antioxidants, the inflammatory compounds, they all wash through those arteries. Over years and decades, the cumulative effect of those meals determined whether your coronary arteries stay clean and flexible or whether they become narrowed, stiffened, and inflamed. Cardiovascular disease remains the leading cause of death globally. In the United States alone, someone dies from a heart attack every 40 seconds. But here's what makes that statistic both devastating and hopeful. The majority of cardiovascular events are preventable. The research is unambiguous. Diet is among the most modifiable risk factors for heart disease, arguably the most modifiable, which means tonight's conversation is not academic. It is urgent. Part 2. The enemies of heart health, foods that damage. Trans fats and saturated fats. Dr. Rose. Let's start with the villains because I think it's important to name them clearly. The first major dietary threat to cardiovascular health is artificial trans fats, or partially hydrogenated oils. These were invented in food laboratories to extend shelf life and improve texture. They do that job well. Unfortunately, they do a catastrophic job inside the human body. Trans fats raise LDL cholesterol, what most people call bad cholesterol, while simultaneously lowering HDL cholesterol, the good kind. That double blow accelerates the development of atherosclerosis, the buildup of plaques inside your arterial walls. The FDA has moved to eliminate artificial trans fats from the food supply in recent years, and that is genuinely good news. But they haven't vanished entirely. They can still appear in partially hydrogenated oils found in some processed snacks, frozen pastries, and certain fried foods. Always read your labels. Saturated fats are more nuanced. The relationship between saturated fat and heart disease has been debated in the literature for decades, and the picture is genuinely more complicated than we once believed. Not all saturated fats behave the same way. However, the consensus among major cardiology organizations, including the American Heart Association, continues to recommend limiting saturated fat intake, particularly in the context of an overall dietary pattern that is heavy in processed foods. The key is substitution, replacing saturated fats with unsaturated fats, particularly polyunsaturated fats, consistently improve cardiovascular outcomes in clinical studies. Added sugars and ultra-processed foods. Dr. Rose, if I had to name one emerging dietary villain of the past 2 decades, it would be added sugar, particularly in the context of ultra-processed food consumption. We are, as a society, swimming in sugar. It's hidden in salad dressings, in bread, in pasta sauces, in breakfast cereals marketed to children. The average American consumes somewhere between 17 and 20 teaspoons of added sugar per day. The American Heart Association recommends no more than 6 teaspoons for women and 9 for men. What does excess sugar do to the heart? Multiple mechanisms are at play. High sugar intake promotes insulin resistance, which over time can lead to type 2 diabetes, a powerful independent risk factor for cardiovascular disease. Excess fructose, particularly from high fructose corn syrup, is metabolized heavily by the liver and can lead to elevated triglycerides, another marker that strains the cardiovascular system. High sugar diets also promote systemic inflammation, and inflammation, I want you to understand, is at the very heart of atherosclerosis. Ultra-processed foods, a category that includes packaged snacks, reconstituted meat products, sugary beverages, and most fast food, are engineered to be hyper-palatable. They're designed to override your satiety signals, and they are consistently associated in large epidemiological studies with increased rates of heart disease, stroke, and cardiovascular mortality. When we talk about dietary change, reducing ultra-processed food consumption is one of the highest impact moves you can make. Sodium and its role in blood pressure. Dr. Rose, I must also speak about sodium. Hypertension, high blood pressure, is sometimes called the silent killer, and excess dietary sodium is one of its primary drivers. Blood pressure is essentially the force your blood exerts against your arterial walls with every heartbeat. Chronically elevated pressure damages those walls over time, making them stiff, prone to injury, and vulnerable to the plaque buildup that characterizes atherosclerosis. The average American consumes over 3,400 milligrams of sodium per day. The recommended limit is under 2,300 milligrams, and ideally, for those with elevated blood pressure, under 1,500 milligrams. The vast majority of that sodium doesn't come from salt shakers at dinner tables. It comes from processed and restaurant foods, soups, cured meats, cheeses, fast food, frozen meals. Reading labels and cooking more of your own food are the most effective strategies for bringing sodium intake under control. Part 3. The heroes, the foods that actively support cardiovascular health. And I want you to notice something as I go through this list. These are not exotic supplements or expensive superfoods. These are real, whole foods that human beings have been eating for thousands of years. We begin with healthy fats. Omega-3 fatty acids, found abundantly in fatty fish like salmon, mackerel, sardines, and trout, are among the most well-studied cardioprotective nutrients in existence. They reduce triglycerides, lower blood pressure modestly, reduce inflammation, decrease the risk of arrhythmias, and may slow the development of atherosclerotic plaques. The American Heart Association recommends eating fatty fish at least twice per week. For those who don't eat fish, plant-based sources of omega-3s include flax seeds, chia seeds, walnuts, and hemp seeds. These contain alpha-linolenic acid, or ALA, which the body can partially convert to the longer-chain EPA and DHA forms found in fish, though the conversion rate is modest. Fish oil supplements may be appropriate for some individuals, particularly those with elevated triglycerides, but I always recommend discussing supplementation with your physician before starting it. Monounsaturated fats, found in olive oil, avocados, and many nuts, are another cornerstone of heart-healthy eating. Extra virgin olive oil in particular has been extensively studied, most famously in the PREDIMED trial, a landmark randomized controlled study published in the New England Journal of Medicine. That study found that a Mediterranean diet supplemented with extra virgin olive oil significantly reduced the risk of major cardiovascular events compared to a control low-fat diet. The effect sizes were clinically meaningful and impressive. Fiber and plant-based foods. Dr. Rose, if there's one macronutrient that doesn't get enough credit for cardiovascular protection, it's dietary fiber. Soluble fiber, found in oats, barley, legumes, apples, and flax seeds, binds to LDL cholesterol in the digestive tract and helps carry it out of the body before it can be absorbed into the bloodstream. It's a natural cholesterol management tool, and it works. Studies consistently show that high dietary fiber intake is associated with lower rates of coronary artery disease. Legumes deserve a special mention. Beans, lentils, chickpeas, and peas are nutritional powerhouses that are underutilized in most Western diets. They are rich in soluble fiber, plant-based protein, folate, magnesium, and potassium, all nutrients that support cardiovascular health. They have a low glycemic index, meaning they don't spike blood sugar, and they are extraordinarily affordable. I tell my patients, if you can do nothing else, eat more legumes. Vegetables and fruits, particularly those rich in potassium, antioxidants, and polyphenols, are foundational to heart health. Potassium helps counteract the blood pressure-raising effects of sodium. Leafy greens like spinach, kale, and arugula are rich in nitrates, which the body converts to nitric oxide, a compound that relaxes and dilates blood vessels, lowering blood pressure and improving circulation. Berries, with their high anthocyanin content, have been shown to improve endothelial function and reduce oxidative stress in the arterial walls. Nuts and seeds. Dr. Rose, I want to take a moment to advocate for nuts because they remain one of the most consistently cardioprotective foods in the nutritional literature, and yet many patients are still afraid of them because of their calorie density. Please set that fear aside. Multiple large prospective studies, including the Nurses' Health Study and the Physicians' Health Study, have found that regular nut consumption is associated with significantly reduced risk of cardiovascular disease and cardiac death. Walnuts are particularly notable for their high ALA omega-3 content. Almonds have been shown to reduce LDL cholesterol and improve the LDL to HDL ratio. Pistachios appear to benefit blood pressure. A small handful of mixed nuts, roughly 1 ounce, eaten daily is a simple, practical, evidence-backed habit. These are not empty calories. They are calorie-dense, yes, but they are nutrient-dense in equal measure. Part 4. Dietary patterns that protect the heart. Now, I want to zoom out from individual foods and talk about dietary patterns because no one eats nutrients in isolation. We eat meals. We eat across cultures and traditions, and the research is increasingly clear that overall dietary patterns matter more than any single food or nutrient. The Mediterranean diet is the most evidence-rich dietary pattern for cardiovascular protection that we have. Characterized by abundant vegetables, fruits, legumes, whole grains, nuts, olive oil as the primary fat, fish at least twice weekly, moderate poultry and dairy, and limited red meat and sweets. It is not a restrictive diet. It is a rich, flavorful, culturally vibrant way of eating. The PREDIMED study I mentioned earlier, along with dozens of other high-quality studies, has demonstrated its power to reduce heart attacks, strokes, and cardiovascular mortality. The DASH diet, Dietary Approaches to Stop Hypertension, is another evidence-based pattern developed specifically to lower blood pressure. It emphasizes fruits, vegetables, whole grains, low-fat dairy, lean protein, and nuts, while limiting sodium, red meat, added sugars, and saturated fat. Clinical trials have demonstrated that the DASH diet can reduce systolic blood pressure by 8 to 14 points, a reduction comparable in some cases to the effect of a single antihypertensive medication. Plant-forward diets, including vegetarian and vegan diets, when well planned, are associated with lower rates of hypertension, lower LDL cholesterol, lower BMI, and reduced cardiovascular risk. I want to be clear, you don't have to be entirely plant-based to reap significant cardiovascular benefits, but moving the dial, increasing the proportion of plant foods in your diet while decreasing animal foods, particularly processed meats, consistently improves cardiovascular outcomes. Part 5. The role of inflammation, the hidden connection. I want to spend some time on a concept that I think is underappreciated by the general public, but is increasingly central to our understanding of heart disease: chronic, low-grade inflammation. Atherosclerosis, the hardening and narrowing of arteries, is not simply a plumbing problem where fat passively clogs pipes. It is an inflammatory disease. The plaques that build up in coronary arteries are not inert deposits of cholesterol. They are complex inflammatory lesions involving immune cells, lipids, and connective tissue. When those plaques become inflamed and unstable, they can rupture, and it is this rupture triggering a sudden blood clot that causes most heart attacks. Diet is one of the most powerful modulators of systemic inflammation we know of. Diets high in ultra-processed foods, refined carbohydrates, added sugars, and certain industrial oils promote an inflammatory state throughout the body. Diets rich in vegetables, fruits, whole grains, legumes, fish, nuts, and olive oil are anti-inflammatory. The polyphenols in berries, the curcumin in turmeric, the sulforaphane in broccoli, the resveratrol in grapes, these are not marketing buzzwords. They are bioactive compounds with documented anti-inflammatory properties. High-sensitivity C-reactive protein, or HSCRP, is a blood marker of systemic inflammation that we measure in clinical practice. Patients who adopt Mediterranean or plant-rich dietary patterns consistently show reductions in HSCRP. That reduction translates into measurable reductions in cardiovascular risk. Food can calm the fire that burns in our arteries. That is a profound and empowering truth. Part 6. Practical Strategies: Changing How You Eat. The end of our program tonight is so important because information without application is just trivia. So, let me offer you some concrete, actionable strategies that I give my own patients. First, make vegetables the foundation, not the garnish. The most transformative dietary shift most of my patients can make is simply this: treat vegetables and legumes as the main event and build the rest of the meal around them. Not a side salad, not a few florets of broccoli. Abundant, varied, colorful vegetables as the centerpiece of your plate. Second, swap your fats. Replace butter with extra virgin olive oil in most cooking. Replace processed snack foods, crackers, chips, cookies, with nuts and seeds. Replace fatty processed meats with fatty fish or legumes. These are not deprivations. They are upgrades that your palate will adapt to and your heart will thank you for. Third, read labels with intention. Look for added sugars, and remember they appear under dozens of names: high fructose corn syrup, dextrose, maltose, cane juice, fruit juice concentrate. Look at sodium content per serving. Look for partially hydrogenated oils. Knowledge is your first defense. Fourth, cook more of your own food. This single habit is perhaps the most powerful lever you have. When you cook at home, you control what goes in. You control the salt, the fat, the sugar, the quality of ingredients. I am not asking you to become a gourmet chef. I am asking you to make simple, whole food meals at home with greater frequency. Fifth, don't drink your calories. Sugar-sweetened beverages, sodas, juices, energy drinks, sweetened coffees are among the most cardiovascularly harmful dietary choices you can make. They deliver sugar rapidly without the fiber and nutrients that come with whole food. Switching from sweetened beverages to water, sparkling water, unsweetened tea, or black coffee is a high-impact, low-effort change. Sixth, be patient and compassionate with yourself. Dietary change is not a light switch. It is a gradual, iterative process. The research shows that even modest improvements in dietary quality, not perfection, just improvement, yield meaningful cardiovascular benefits over time. You are not trying to eat perfectly, you are trying to eat better, more consistently across the weeks and months and years of your life. Closing remarks. I want to close tonight with something personal. I became a cardiologist because I wanted to fix broken hearts, and the surgical tools we have are extraordinary. Stents, bypass grafts, defibrillators, ventricular assist devices. The engineering of modern cardiac medicine is genuinely remarkable. But the longer I practice, the more I've come to believe that the most powerful cardiac intervention doesn't happen in an operating room. It happens in a kitchen. It happens at a grocery store. It happens in the small, daily decisions we make about what we put into our bodies. Your heart has been beating for you every moment of your life without asking anything in return. Tonight, I'm asking you to start giving something back. Not perfection, just attention, just intention, just the willingness to begin moving, one meal at a time, toward a way of eating that loves your heart as much as your heart has loved you. Thank you.